All right, well, welcome to the second webinar in this series, the Aged Care Impact Series. My name's Sam. I'm the Comms Engagement and Events Manager here at the DHCRC. And for those of you who weren't at the first webinar, I will pop in a link once I hand over to Megan. But a very warm welcome to all of you. And I'm just going to kick off with a quick acknowledgement of country and then we'll get started. So in the spirit of reconciliation, the Digital Health CRC acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past, present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Just a little bit of housekeeping before I kick off as well. Today's webinar is obviously being recorded. You'll get this link shared with you via recording over the next probably 24 hours. Please pop any questions that you have in the chat and we'll do our best to get back to you and answer them at the end of the presentation. Keep yourself on mute so we can avoid any disruptions if possible. But obviously when we're doing Q&A, you're more than welcome to come off mute and ask those questions. So now I'm going to hand over to Megan Snewin, our Senior Program Manager and Aged Care Strategy Lead here at the Digital Health CRC, who's responsible for taking this initiative forward. She's going to run through what we're going to do today, and it's an exciting one for anyone who's here. So welcome and thank you, Megan.
So, what are we going to talk about today? So thank you for joining us here today. As Sam said, I am Megan Snewin. I am the Senior Program Manager from the Digital Health CRC. I've been here for about 5 years and we've embarked on these series of webinars. This is our second in a series of webinars that we are holding monthly through to December. And the quick agenda and recap, the quick agenda for today. We've got a recap of what we did in the last seminar. I want to talk a bit about the partnerships that we'll need for this work and going forward. I'll unveil the brand that we're going to use for this work, talk a bit about timeline, and a call to action, and we'll end with the Q&A session. So we may not use both, the full hour, but we have allocated that. So we've got plenty of time at the end for the Q&A session. As I said, so joined on the call with me today is Dr. Claire Morgan, our Deputy Chief Executive Officer and Director of Research, Commercialisation and Translation, Dr. Isabel Freen, Director of the Digital Health Integration and previous Chair of HL7 and is driving force behind this work with me, and of course our Chief Executive Officer, Annette Schmidi, who has been championing this work and cause for digital transformation in the aged care sector and underpinned by standards for a long time. We've got a number of other team members on the call today, and yeah, we will get started. So yeah, as I said, we're sharing a couple of bits of exciting news and then finishing off with Q&A session. So just a bit of a recap for those that weren't able to join us last time. We shared really what we're doing and why we are embarking on this work. We have had a 5-year program of work under our flagship program, project called Aged Care Data Compare, or ACDC for short. And we are looking to build upon those research findings and scale those project outputs. So we shared last time on the call that we're committed to building a production-ready, inter-array, long-term care facility smart on-fire quality indicator app. That this work is that we need strong and engaged sector to help us with this work. and that this work is happening fast and will be built between now and the end of the year in order to demonstrate to government what is feasible in terms of a technical solution for standardisation of functional assessments in Australia. So yes, the build is happening between now and the end of the year, and I'll share some specifics around that timeline later on in the presentation. So I think what we're really hoping to do with this work is, and our key objective is really to demonstrate to government and to help influence and raise the level of comfort to bring the decision around a mandate for functional assessment. And secondary objective is for this app to be leveraged by the INTERI international, or any other country that's implemented INTERI globally. And supporting industry-led benchmarking initiatives. So, as Sam said, she'll pop a link in the chat to that. Thank you, Sam. You're a superstar. So, yeah, I think we've talked a lot about the collaboration around how we work at the Digital Health CRC and why that model is very unique. And the same applies for the partnerships required for this collaboration. These partnerships, we're hoping will help us gain the groundswell and engage the sector as we need. And I'll explain a few of these partnerships that are required for this initiative. So we're obviously going to need to partner with INTERI International in terms of licensing for the details and be able to evaluate the implementation of the INTERI LTCF questionnaire into a smart on fire context. We'll need to work closely and collaborate with the department and Australian government, health, disability and ageing. So to support the project in terms of providing policy insight and to help make decision on how we integrate with the National Aged Care Mandatory Quality Indicator Program. We've got some ideas about how we go about doing that, but we are looking at input for that. We'll need plural vendors and providers to test this solutions, to share the learnings and to have them exposed to the Smart on Fire way of sharing data and to provide an uplift in the sector knowledge, so being supported by the developer to map in their data elements for pre-population and things like that. So that's another really important relationship which we're going to need to validate these user stories and what we are building. We're obviously going to need a research organisation to validate what we're doing, and of course one of the most important relationships that we are going to have is with a developer, because without a developer we don't have any ability to build what we say we're going to build, to develop the app and the other componentry that we'll need. So we have some exciting news from that point of view. During the month of June, we held a request for proposal and quote process, which the chair of our board, Kate Munnings, was part of, and we've been working quickly to secure a developer and really excited to announce that this process has been concluded and announce that our developer partner will be Beta Software. We have today on the call Jana, their CEO, and their Chief Technology Officer, Ilya, joining us. We are absolutely delighted with this outcome. We saw Beta's proposal as very innovative, and we are really excited to be working with them. So Beta is a globally recognised team working in the digital health space, and they've been helping helping companies develop and launch interoperable solutions for some time. They absolutely have the expertise that we need for this project. And they also are committed to doing this work in the very compressed timeline that we have. So we thank them in advance for their hard work. Beta has authored a number of various open source tools and products for FHIR native development, driving really a key driver to adoption and working heavily in the FHIR community. They were also founding members of and an active contributor still to the Sparked FHIR Accelerator. Jana has most recently been spotted at Dev Days doing on YouTube, sharing her views about the future of FHIR. I'm sure you can find that by doing a quick Google. She has deep software engineering and product background, starting her career in large hospital implementations and working with digitization. So deep experience in this area. She has a mission to simplify clinical workflows and to support and overcome barriers in the healthcare ecosystem that are really stopping interoperability. Quick search of Ilya on LinkedIn and you will understand Ilya's deep experience in FHIR and how ingrained he is in that community, in the HL7 FHIR community. He has experience in the healthcare business domain and as I mentioned, them as an organisation, Beta, but also Ilya specifically has been a key contributor to the FHIR IG and a regular participant around the globe at the HL7 Connectathons and other international events. Ilya's passionate about the knowledge sharing and education aspect, which we are really excited about because we see this as a key opportunity for providers and vendors to get that knowledge from Ilya and the team and to gain knowledge in FHIR. So yes, Beta have real world digital health implementation experience. Outside their bios, these Ilya and Jana are very down to earth, approachable, and as I mentioned, innovative. So we're really looking forward to working with them to help deliver this app. So Ilya and Jana, if you're here, maybe pop your cameras on and say hi. I've got a question.
Yeah, thank you so much for this opportunity. We are so excited about this project and really believe this partnership would be a great experience for both of us. So thanks again.
Yeah, hi everybody, nice to see all of you here, nice to be part of the team, and yeah, happy to contribute to this project.
Thanks both. So Jana, I'll put you on the spot. I know we haven't prepped for this, but what motivated you to get involved in this work?
When we heard that you guys are looking for a partner who are part of the Spark community and who really knows the FHIR, the standards to bring this into life into healthcare sector. We are thinking this is a really great match because this is what we love to do, converting the standards and IGs into real life products. And here for healthcare sector is really paying that digital infrastructure is fragmented, and we can show an example, a showcase how it can work all together. And yeah, really love this idea and looking forward to the implementation.
Thank you. Yes, so we're just about to kick off the development next week. We're starting this work and I'll be seeing a lot more of both of you on the screen. We have another bit of exciting news, and this initiative that we've been working on at the Digital Health CRC has way too many acronyms in the name. So we have decided that we will brand this as a Digital Health CRC initiative, but warrant its own branding, given that it may extend beyond our life of the CRC. So unveiling exciting news number 2. We've got a new brand and name of our app, which is Connexus, which ultimately Annette Schmidi made the call on, but we had some really good choices, so we've landed on this one. And this branding is grounded in the theme of data merge, which you can see sort of from the icon to form the K, the data first visual approach, and the symbol to sort of reflect the ever evolving stream of data and information flowing between aged care and other settings, really sort of resonated with us. The name of Connexus has come about in a creative way as well, formed from the word kin, which is family or care, which we know is one of the key important aspects of aged care, and combined with the word nexus, which is connection. So, coupled with a bit of great phonetics sounding like Connexus, we have landed on the name Connexus for our solution. So we're hoping it aligns also, with our bright, colourful theme here at Digital Health CRC, and that this sort of visual graphic represents the connection and the wider scope and the engagement between the parties that we'll need to do to collaborate and shape this. So a real positive of this name is that I'll never have to say again InterEye LCTF Smart on Fire QI app, which is a massive mouthful and has lots of acronyms. So we are, five acronyms deep to one word. We're really pleased. So thanks, Annette, for ultimately making the decision on this. We hope that this word and this logo and this branding resonates and aligns with what we're doing. And yeah, we'll be using the word and branding from now on. So having a timeline is a really important way of sort of just talking to this audience in particular about what's going to be going on in the next 6 months. This is very high level. We've just got a developer on board, so it is obviously been working steadily up to this point in May and June. So why is November important to us in terms of demonstrating this to the government, and how do we work back from that point? So we understand that there's a lot of work going on in the landscape to influence decision makers around policy in government and in the sector. This includes, but isn't limited to, the consultation around the aged care data and reporting review, which is to develop the aged care data and roadmap. So this specific that specific work does have a focus on standardisation, data standardisation and reporting, so all of which are consistent with the theme and what we are doing. There are other strategies also being moved forward, and the demonstration on the demonstrator that we want to do with Connexus and other like Connexus, all of these will be helping to advance these decisions and conversations to support the policy, and then understand what the transition is, related to the implementation of these roadmaps. So time is of the essence. These consultations are out now, mentioned, like the roadmap. So what we want to do is contribute to these conversations meaningfully with what the art of possible is, and demonstrating that to government by November. And so if we work back from there, talking through what we undertook in May and June was the initial engagement with vendors and providers. We've written our requirements and also formulated the RFP. As I mentioned, in June and July, we went through the RFP process and with our preferred developer are now kicking off that development in June and July. In July and into August, we really hope that we can cement those collaboration and partnerships with our vendors and providers. And we'll start with beta to understand the discovery and work through the discovery phase and into the technical architecture. So get a little bit under the covers. So into August and through September, we'll be starting to generate and map the inter-eye assessment into the Smart on FHIR app context. And each month, you'll see that there is a project showcase and playback for us to be demoing what we've done and also this webinar. So it's a pretty full-on run into October and November. We've got in October implementing the QI B2G or the business to government submission. We've got a couple of options about how we do that. Then, as I said, mentioned November is when we're looking to demonstrate. So yeah, moving into December and beyond, you know, possibly looking at future international opportunities. How do we work with using this as a base for industry-led benchmarking to go forward? So I'm just sharing this as a way of, you know, sort of the flow of information that we are sort of dealing with in terms of our scope, and the diagram really is what we're embarking on building. These user stories will be fleshed out over the design phase in the next few weeks and will be written up next time in a way that we can share in Word format. So just talking through this, I know it's very technical, but I know there will be some technical people that are interested on the call on this. So the app will launch from within the vendor clinical information system. We've got that represented as one or many down the side there. It'll bring in data and pre-populate. The assessment will pre-populate based on whatever information is held in the clinical information system. Upon then, you know, doing the assessment, the long-term care facility assessment, the app will then, once you've submitted that, will generate the quality indicators, which will resemble the National Aged Care Quality Indicator Program, and then in turn we'll be looking to submit those through to government for reporting purposes, known as B2G for short, and have that data available for providers in some dashboard or other way that can be used for quality improvement. And over time, we will look to sort of sending that data through the other initiatives underway at ADHA, the Health Information Exchange, etc. So that's just a bit about the scope of what we're doing. Ilya, if you're still there, I've got a question. I've got a question for you. Part of Beta's proposal in terms of innovation that you shared with us was an aged care simulator using the Beta EMR. Can you describe, Ilya, why that has been proposed as a part of the solution?
Yeah, thank you for such a beautiful question. So, yeah, unfortunately, aged care software vendors, they will not provide us with FHIR API from the day one. It's more like a long-term journey when we will need to work out how implement it in a best way. But we still need to implement the software, check how it works, and so on. And from my past experience, especially building integration with various EHRs and EMRs, sometimes it makes sense to build a very simple simulator that just provide a minimal necessary amount of data. So we are going to review this inter-RAI form and map all data we have into FHIR to see how it could be populated from data sources that supports EU core. And once this work is done, we can pretty easily build a very simple software for data entry on top of BEDA EMR and start testing the application without waiting for HKS software to be ready. So it can help us to make work in parallel. That's crucial for such a tight timeline for this project. And also, I think most likely the implementation of the simulator, it maybe will be open source, so HK vendors will be able to learn how it works under the hood, and it helps them to implement FHIR API in their products. Yeah.
Thank you. Isabel, did you have a question?
It was really a comment to say that the other reason why we were particularly attracted to the idea of creating a simulator was we're absolutely mindful that there's so much going on for the sector, vendors and providers alike, and yet other fairly significant policy decisions are going to be made over the course of that period. So how do we balance progress at sort of rapid pace with respect for the pressure and demands on the sector? So being able to get a sort of head start using the simulator was just such an important and valuable contribution that BEDA have proposed. I think also the point, Ilya, that you've just made is worth just re-emphasising for aged care vendors, but also providers here. What we also want to achieve, in addition to building a demonstrator product, is we want to start the conversation around, well, what do you as an aged care provider organisation need to know and understand about standards and specifically FHIR, data quality? What do you as an aged care clinical information system developer need to understand about Smart on FHIR data standardisation? And so part of the value add that we're trying to offer to both aged care vendors and providers in getting involved in this project is the opportunity to benefit from the experience and the learning, the considerable experience and learning that BEDA have in this space. Why is that important? Well, the government agency just released its digital health procurement standards for comment. If you haven't had a chance to read those, I encourage you to do so. But you won't be surprised to read that FHIR is going to be a major proposed capability of clinical information systems moving forward, and will impose some long-term constructive demands on aged care providers. And so, we're hoping that through these webinars, even if you don't get involved with your vendor in your organisation, that you come along the journey with us, so that you are learning and understanding about what's involved, what's the lead time for essentially becoming FHIR ready. So and a large part of the offering from BEDA is indeed providing that knowledge and skills transfer using a range of mechanisms that we will obviously get into more detail on in the coming weeks to support that sharing and capability uplift. So yes, that was my short comment, Megan.
No, thank you, Isabel. Hugely relevant. And I think that was all that I had in terms of covering off content, Sam. Before we go to Q&A, I just wanted to reiterate the call to action, to join us. We've talked about our timeline, which is very tight. We are still inviting vendors and providers to join us while we're in discussions with a couple of major vendors and looking to formalise those partnerships between now and the next webinar. We've been hugely encouraged by the interest that we're seeing, even from some international people reaching out. So please, the more the merrier. The next webinar is the end of August, and registration is open for that. Oh, Sam, she's a godsend. Everyone needs a Sam in their life. She's popped those in the chat. Thank you, Sam. And so we look forward to giving you an update next time on our development, see how far we've gotten, and we'll be sharing that. We'll be obviously sharing our partnerships that we are close to securing for our vendors and providers. And yeah, let's hear from everyone else. I suppose it's enough from me. Sam, how did you want to play Q&A?
If you just want to flick to the next slide. So if you do have questions, we encourage you to either pop them in the chat or raise your hand via the Teams function, and then we'll come to you and you can come off mute. But we do have one from
I'll take the first
Isabel.
one, Sam. Yeah, I'll take Isabel's.
I might just read it quickly for
sorry.
those that get the recording. So the question is, integration with vendors and providers is scheduled for September 2025. Is this intending to leverage Sparked for testing and coordination? And is this intended to go through a formal balloting process so that it's endorsed as going through the FHIR community process by HL7AU?
So the quick answer, Isabel, is yes, but not yet. What we're wanting to do with our tight time frame is to demonstrate what's feasible, and subject to those demonstrations, in collaboration, obviously, with the Sparked program. Establish, well, what's the best way to take that through the formal FHIR community process. As a board member of HL7 Australia, I'm very familiar with the absolute criticality of consensus-based standards development. The shortcut, if you like, that we're taking for the purposes of this demonstrator is to use the inter-array long-term care functional assessment data elements, data definitions. These are data definitions that have been through their own international and many multi-year consensus building process. So we are, it's not as though we're going to be, when we move, if and when we move in this work into the formal FHIR community process, it's not as though we will be starting from a sort of random position. We will be starting from a position where there has been a reasonable amount of, or considerable amount of consensus work. But, you know, what we're not wanting to do, and it's really important, I emphasise this, we're not trying to destabilise the Sparked program. We see this is almost about putting aged care first in the queue for the next sector that gets incorporated into either the broadened scope of Sparked or a separate parallel approach to using what's called the FHIR community process, which would in turn result in a potential balloting exercise. So we're sort of doing an early march on that process. We work very closely with CSIRO, and they have been instrumental in over the last 5 years in the HK Data Compare project, and a lot of the resources that BEDA software will be starting with will be building out on the work that was done for us with CSIRO as part of ACDC. So maybe because it's a really important question. Isabel, you can give some, either come off mute or camera, or just in the chat, just indicate whether that answers your question, or if there's any other questions you've got on the back of my response, maybe you could put that into the chat.
No, not at all. Honestly, that was a great response. Thank you. I think it's really good to see aged care starting to build their FHIR maturity in this space. So, and I know Sparked has been an sort of excellent avenue in getting that cross-sector collaboration involved. So, no further questions. Thank you.
And what's the perspective that you're coming from? Just to share that with everyone, Isabel.
Yeah, sure. So my name's Isabel. I'm from the Department of Health and Aged Care. We work in the standards section of the digital health branch. So we work very closely with CSRO in accelerating the adoption of Spark standards through the FHIR Accelerator. So we've got a lot of like policy initiatives that we're looking to solve via digital enablement through FHIR. Yeah, so by all means, you know, we sort of advocate for getting people to utilise that avenue for testing and demonstrations.
Right, thank you very much.
Thanks, Isabel. The next question we have is from Rosanna in the chat. I believe she's from the Safety and Quality Commission, but correct me if I'm wrong. She asked, will the tool be suitable for medication management software used in residential aged care?
I'm happy to take that. There might be others that want to jump in. I think explicitly the quality indicator tool, less so, but certainly Smart on FHIR capabilities, absolutely. And you know, so this is another value add for why developers of the electronic medication record and users of that medication record, you know, might want to walk alongside us on this journey to understand how that transferability to basically all other moving digital parts of aged care clinical information is going to work. There are well, let me turn this around another way. As we go along, we will be publishing the use cases that we will be putting the Connexus app through. So what we might do, Megan, is just put this on the list, on the backlog of those use cases. Obviously, there are quality indicator apps. There are quality indicators relating to medicines. There are elements to medicines usage, certainly within the Inter-A larger suite of quality indicators. Whether that becomes a specific feature for this app, I'm going to take a punt and say probably not a high priority, but in answer to Rosanna's question, for sure, this will be highly relevant to meds management going forward. And I think, you know, one of the conversations that the Digital Health CRCs really focused on is making sure that, or assisting the sector's understanding about standardisation of data and information, and what that means for all of the current tools that have been defined or required, and how those tools may need to morph into being more standards aligned than perhaps they currently are. That's as diplomatic as I'm going to be able to make it in making that statement. But Rosanna, if you wanted to either come off mute and say whether that's answered your question or challenged my response, don't feel obliged. But it's a good question, and we will consider that as part of the use case backlog.
Thank you. Appreciated.
Thank you. And I can see a question in there from Vincent, which is around exactly what sort of software vendors are you looking for? So we're looking for vendors that are providing technology solutions into residential aged care facilities, not necessarily ones that have had experience with InterEye. And so what we're looking at doing as part of that scope is mapping in the InterEye assessment, creating a launch context in the software so that the questionnaire opens in context, mapping in the data from the clinical information software into the InterEye assessment, pre-populating that, and then having the assessment launch and being able to save that and send it off to QR. So anything else you wanted to add there, Isabel?
Well, I think perhaps I need to say that obviously we've the Aged Care Data Compare project for the last 5 years has partnered with a number of active and a number of interested aged care clinical information system vendors. We are, for the purposes of Connexus now, in conversation with at least 2 vendors, and I would hope by the next webinar, Megan, we would be able to share with everyone who those vendors are, and indeed who some of the potential aged care providers are that will be participating, supporting, providing their development environments in support of this project. So hopefully that answers your question, Vincent. And come off mute if you would want to add anything further to that.
Oh, good. Anything else coming in, Sam?
No, nothing else. But if anyone does have any questions, feel free to, like I said, pop it in the chat or raise your hand or just come off mute. But if nothing else comes through, then we might wrap up, Megan.
Yeah, sounds good. So as Sam has said and linked in the day of the next webinar in August, and the link is in the chat to register for that. We would love to see you there. In the meantime, feel free to reach out to us if you've got any other questions. Sam will send a wrap up with this recording via email, and I think it's hosted. Annette, you've got something to say before we wrap up?
Well, just before we wrap up, I'd just like to add my thanks to everybody for coming along to the webinar today, our second one, and encourage you to continue to participate and just reinforce the message that we really want to, and we're committed to working collaboratively with the sector. That's everybody, providers, vendors, policy makers. For the Digital Health CRC, time is tight as we have our finish date towards the end of next year. So we're really on a tight timeline. But this is the this has been one of our most important projects that we've funded and participated in. It goes back almost over 5 years now, and so it's very exciting to see it getting to this pointy end of all that hard work and great dedication of the team that's been involved. So looking forward to continuing to participate in these webinars as we share the journey with everybody. So just leave it there and back to Megan.
Thank you. I think that's it for today. And we will see you in August and look forward to connecting through Connexus in between.
Thanks, Megan.
Thanks. Thanks, everyone.
Thanks,
Bye.
everyone. Bye.
Thanks,
Thank
everyone.
you.
Bye.
Thank you. Bye.